Hi, I'm Dr. Felice Gersh, your integrative OBGYN physician. Today, I'm going to talk about a really important topic for every woman who is interested in hormone replacement therapy. That is, how do you get your estrogen into your bloodstream? How do you get it in? Well, I can tell you right out the gate that the best way is transdermal. Transdermal means through the skin. Now, why would that be? And that seems really inconvenient. Well, the reason is that when you take estrogen orally, which would be for many people the preferred route, it gets converted through a process that goes on in the liver, which is part of the digestive tract, into predominantly a different form of estrogen. The one you swallow is estradiol. That's the one that is made by the ovaries, but it's converted predominantly into estrone, which is a different type of estrogen, which is natural to be found in the human body, but not to be the dominant one. And everything that is good can be harmful if you have too much of it. Estrone is good, but when you get it into your body as a bolus through the liver, that's not good because it acts differently on the receptors than the estradiol, which is what we want to get in. In addition, we now have very good data that if you take oral estrogen, whether it's Premarin, that's conjugated equine estrogens, or estradiol, which is a bioidentical type, it actually, both types will turn into risk factors for blood clots. So conjugated equine estrogens like Premarin increase the risk of blood clots 400%. That's fourfold. And if you are unlucky and have factor V Leiden genetic findings, that you have two of these genes, so you're homozygous, it can actually increase the risk of spontaneous inappropriate blood clotting 16 times. Oral estradiol, the bioidentical kind, will increase the risk 200% or double the risk. So, and I'm going to come back to this a little while later in this talk, because there are some people that feel that there are some cardiovascular benefits, but I'm going to try to debunk that, okay? But let's go to my personal favorites, the transdermal forms. And then we're going to talk about, just so you know what's coming up, I'm going to talk about rings and pellets and sublingual and shots. Almost never done, but I'm going to cover that too. So let's talk about what is now generally considered to be the optimal way. There are exceptions, but I think they're wrong, of course. I respect their opinions, but I'm going to try to present mine. So when you get your estrogen in the form of estradiol transdermally, it does not convert immediately into estrone. Now, some will be converted into estrone, and that's appropriate because that's what happens in nature. But it has to happen in an appropriate way according to the body's needs, because in the bloodstream, there's an enzyme and in organs that can convert estradiol back and forth to estrone. But that should be controlled so that the body does it as it needs it and wants it. We are not smart enough to know how to micromanage this type of thing in all the different organ systems simultaneously in the body. So once you decide you want to get your estradiol in transdermally, what shall you use? Well, the most common, and by the way, I like them all. They all have some pros and cons, which I'm going to present. So the most commonly used are the estrogen patches. Now, the estrogen patches go back many years, a few decades, in fact, and the earliest ones were different from the current ones. They were made with what was called an alcohol reservoir. The earliest one was Estroderm, and it was quite large. It was quite bulky. It actually stuck out from the skin because it had alcohol in it that acted as a storage site for estradiol, which was then released through the skin from this reservoir. Well, that became archaic, thank goodness, and they developed a flatter patch. And the flatter patch was later developed into the dot, which is the current one, which is mostly used, which is a very small size patch. And it's quite flat, it's clear, it doesn't stand out, it doesn't look really ugly, but it goes in an area which most people don't see, the lower part of the abdomen. So this is a very amazing technology, and that is what was patented initially. Well, the patent ran out, and now all the patches on the market, with very few exceptions, are generic. Some of them are what we call branded generics, so they may have a name like, say, Dottie, so on, but they're actually generics, okay? And now being a generic means that it's supposed to be quite similar to the original one that was patented. So they're similar, but they're not identical. They are allowed a fair amount of leeway. So between the different brands of generic patches, there can be some significant differences. So if you use a patch and you know the company or the name that's assigned to it, so based on who's making it, and you're doing well and you're getting the levels you want, try, if you can, to keep getting the same patch from the manufacturer that is working for you. I've had patients where they went to the pharmacy and they switched manufacturers of the patch, and they went from great control to terrible control. Now, what about the dose? How would you know what dose of patch? They come in 5 strengths, starts with the smallest, which I almost never use. It's such a tiny dose. It usually doesn't get you out of the menopausal range of estrogen levels, and that's the 0.025. But it does still do some good, and it can help reduce night sweats and hot flashes, and it does have some benefits for the bone, even at that really tiny dose. And then the next one up is the 0.0375, then the 0.05, then the 0.075, and the highest dose of the patches, which is not high, just let you know, but it is much higher than, 4 times higher than the bottom smallest dose, and that's the 0.1 milligram. As you get a higher dose, guess what? The patch gets larger in size, but it never gets to be really big. It's always quite small. I would show you, but I don't get samples anymore because they're all generic. But you can go online, you can Google them, and I'm sure you can easily find photos of these estrogen patches. Now, what about the dose? I mentioned there are many. There is no way that you can know for sure what blood level you'll achieve with any particular patch, because there are studies, and there was a recent one published by my friend, Dr. Louise Newson from the UK, which showed what I've known for a long time. Every one of us who's in the field knows that you can give the same dose patch to 20 different women. You will get 20 different levels, and not just a little difference between them. They can be dramatically different. Now, I was involved when the first estrogen patch that was not with the alcohol reservoir that came on the market, that was Vivel. So I was involved with it, and I spoke for the company, educating doctors all over the country on what this patch was and how to use it. So I saw all the original study data that was given to the FDA on this product. And even back then, with the branded product, the levels that were achieved with any particular dose of the patch were incredibly variable. I mean, really variable. So it looked like a scattergram. The dots were all over, and then you know what they do? They draw a line through the middle. So the only way to know what level you achieve is by measuring it. Now, when I measure the level of estradiol in the blood in someone on the patch, I get it the day after the patch was on for consistency, because that's another issue with the patch. The amount that gets released into the blood is going to be highest when it's first put on, and each day it's on for 3.5 days. So it's changed so that you get 2 per week. So the level that's released, the amount of estradiol that's released into the bloodstream, decreases with each day it's on. And so you're going to get a different level day 1, 2, 3, 3.5. In fact, I have some patients, the only way to sustain an optimal level is to change the patch every other day, because by the time you get Past the second day to the third day, it is simply too low. Now, how would you know when to put it on? Well, if you take a night, you go to the next night, the next night, the next night, and the next morning. That's when you would change it. So it's 3.5 days. So you would change it twice a week, once at night and once in the morning. You try to keep track so you don't get confused, and you can write it on the calendar. I use and prescribe a lot of estradiol patches. Well, it's very safe, it's very easy to use, and it's typically covered by insurance, which for a lot of people is really important. So just be aware, patches are the most common and they are good. But here's the thing, even using the highest dose patch will not infrequently not deliver a high enough or adequate level of estradiol in the blood. So then you would have to use a patch and a half, like say a 0.1 and a 0.05, or even 2 of the 0.1s. And this is okay, because you're not going to get overdose. You monitor the levels. Now, this is assuming that your goal is like my goal, which may not be your goal, which is to become a super ager and optimize every organ system, which requires dose. You know that dose matters. It matters how much exercise you do. It matters how much sleep you get. It matters how many vegetables you eat. Dose matters. Well, dose matters for estradiol as well. I'll come back to that at the end as well. So you want to measure the level you're achieving if that's your goal, because there is a relationship with outcome and dose and the level that you achieve from that dose. So we have to check. Now, if your goal is simply to relieve night sweats and hot flashes, which is the conventional approach. In fact, that's really what the FDA has approved estrogen to be used systemically for, to reduce night sweats and hot flashes. When we use estrogen for optimization, healthy aging, healthy longevity, that is an off-label use. That is not illegal. We're not doing anything illegal, but it's off-label. There are many, many drugs and hormones that are used off-label. So it depends why you're on hormones. Suppression of night sweats and hot flashes, the smallest dose works for that. If health optimization is the goal, then optimal dose and levels is the goal. Now, what about other forms of transdermal estradiol? The next common, which is also covered by many insurances, and you get both the patch and the one I'm going to tell you about from regular drugstores, regular pharmacies like CVS or Walgreens, Rite Aid, and that is the gels, the estradiol gels. There are 2 basic types. There's a pump type of estrogen gel that's called Estradiol, and in order to obtain anything like a reasonable dose for optimization of health, not suppression of hot flashes, because for suppression of hot flashes, typically all you need is 1 pump. If you're trying to optimize health, then you would have to go to at least 2 pumps. In Europe, 2 pumps is the standard. But in the US, for reasons never explained to me, 1 pump is all that's approved by the FDA. So if you want 2 pumps, you'll have to pay for it because insurances usually won't cover it. And when you do the pump, you then wipe it on each arm. You wipe it all the way up your arm. You don't have to rub it in. It's alcohol-based. So you just want to take the gel and wipe it all over the area of the arm from bottom to top and let it air dry. If you use 2 pumps, you do 1 pump per arm. The other type of estrogen gel, the brand name is also generic now, is Divigel. They come in little foil packets, and they also have multiple doses. So the lowest dose is 0.25 milligrams. That's 1/4 of a milligram of estradiol gel. And the highest dose is 1.25 milligrams as a gel dose. Now, they come in these little foil packs. You open up the foil, and then you press out the gel onto the anterior thigh of your leg, the upper leg, the front of the thigh, and there you wipe it on. You spread it all around. You don't have to sit there rubbing it in. That's not how you get it in. You just put a thin film, you make it a thin film, and you rub it all over the front of your thigh. And then you let it air dry. Now, many patients really like it. Occasionally, patients say they don't like it. They say, it doesn't dry fast enough for them, or it feels a little sticky after it's so-called dried, or they're always in a rush to put on their pants and they don't have time to let it air dry. It's used once a day. So the advantage is that you're going to get a more consistent delivery every day, unlike the patch where every day it's on, the amount delivered is going to go down each day. With the gel, you put it on every day, so you start with the same amount every day. Now, notice the doses are so different. With the gel, when you're talking about the little packets, it goes from 0.25 milligrams up to 1.25. But with the patches, the lowest is 0.025 and the highest is 0.1 milligram. They're like totally different. They're not an exact match, but in general, the lowest of each and the highest of each will be somewhat similar, but they're not exact, like you can go interchange them. You have to try. And since they're different delivery systems, one is a gel and one is a patch, you may get very different blood levels achieved. So once again, you got to check. If you won't know what you're getting in unless you actually have it checked. Now, those are the very common ones that are used transdermally. There's one that's less common, and that's an estradiol spray. So it has like a circle, and it has looks kind of like a megaphone that goes over, and then it's a spray that goes in. Now, I basically never used that because when they did the original study data, which I also was very aware of, it turned out very strangely that 3 sprays, so you can do 1, 2, or 3 sprays. I mean, obviously you can do any number of sprays you want, but that's what they studied. So 1 spray gave a very small blood level, 2 sprays gave a very small blood level, but a little bit higher, and then 3 sprays when they did the studies, delivered an even lower level in the blood than 2 sprays. Go figure, 3 sprays created a lower level in the blood than 2 sprays, and they were all really low. This product was formulated when estrogen was a pariah, when estrogen was considered evil, and the lowest dose was all that people talked about, not optimal, not anything but lowest. So they created this spray to really deliver low. So it's never enough for me for what I'm trying to accomplish. But if your goal is getting rid of night sweats and hot flashes, they got approved by the FDA, because if you waited long enough, could be 8 weeks, even 12 weeks, it tended to be significantly better, not fabulous, but significantly better than placebo. Now, this is the data from the original. It was gone off the market, and it did make a comeback. So I have to be honest with you. After it made the comeback, it left the market, came back, I have not gone and investigated it further because I didn't really see the need, and I knew about the original data, and it seemed the same. So if I am incorrect about anything relating to the spray, I apologize and will be corrected if you have something to say about that, because there are patients out there, women out there, who love the spray, and it can control night sweats and hot flashes. And not everyone has the same goal for using hormones that I have to create a super ager lady. So you may feel like, I don't need that. I just want to feel better. And that's really my goal. And that's okay, okay? Everyone doesn't have to have the same goal in life, okay? And not all of my patients have the same goal either. So everyone's allowed to want what they want, okay? Now, what about other forms of estradiol? Well, there's a vaginal ring, which I actually like, but it's very hard to find. It's very pricey, not covered by insurance. It's called the Fem ring. Usually, if you want it, the pharmacy will have to special order it. It's a manufactured ring, and it comes in two strengths, a 0.05 and a 0.1. And a lot of people liked it. It just never really took off. It sits in the vagina and it delivers estradiol. And we'll talk, if we have time this time. If not, we'll talk about it another time, and that is vaginal estrogen. By the way, the vaginal ring that is femring is systemic in its delivery. It gives vaginal estrogen, yes, but it's designed to increase the level in the whole body, in the bloodstream. The other products that are designed just for the genitourinary system, just for vaginal health and bladder improvement in its health, those are not for systemic treatment. They will never get levels high enough to do anything in the whole body. In fact, they will not expect it to even reduce night sweats or hot flashes if those are present. They're only directed towards vaginal health. And we definitely need to talk about them at some point in the very immediate future. Maybe I can touch on them today too. So what about the cream? Now, once upon a time, it wasn't that long ago, a few years, well, maybe it is quite a while ago, I lose track of time, there was a commercial estradiol cream. It was actually not a cream, it was a lotion, because it was kind of watery to be called a cream. And you had a really large amount of volume of this lotion, and you would wipe it on both legs. So you had to wipe and rub in this lotion every day. It was an everyday dosing, every day into your legs, the whole leg, from your ankle all the way up to the top of your thigh. It was a lot of lotion, and the dose was 1 milligram. So just to give you an idea, it was 1 milligram lotion. It never really took off, and it was taken off the market after just a few years. But some of my patients really liked it, but not available. From a compounding pharmacy, you can get a number of products that are estradiol. One is a Trochee. That goes under the tongue. I never prescribe estrogen Trochees. It's like giving it orally. When you put these Trochees, think of it as a lozenge. You put it underneath your tongue and it will melt. And it sits there for a while, as long as you kind of let it sit there in a sort of melty form. And maybe a little bit gets absorbed through the blood, into the blood through the blood vessels under the tongue, which is a pretty vascular area. But the vast majority of it is swallowed. So it's just another way of getting oral estradiol, which is going to be converted through the liver into estrone. So I talk against the Trochees. Now, the cream is another story. So bioidentical estradiol cream from a compounding pharmacy is very helpful, and I do prescribe it a lot. Now, what are some of the benefits of it? Well, you can actually dose it and concentrate it any way you need to help the patient get what is needed to get the right level that you're looking for, assuming getting levels is part of your treatment, because you're looking to achieve super healthy aging. So then levels matter. So with the estrogen, the estradiol cream, you can make it very concentrated so that if you say 1 milligram, you can get 1 milligram in a very tiny, like 0.1 milliliter. That's really tiny, tiny little bit of volume. Or you can put the same amount of estradiol in a larger volume of carrier cream, and then you could spread it over a larger area. So you have all of these variables that you can control. You can also control where you put it. I think you already know I have tried everything, though. I have used every product out there except the spray personally. And in terms of the cream, the estradiol cream that's compounded, that's what I'm currently using. And I know I told you, because I tell you all my secrets, that I put it on my face for its anti-aging, anti-wrinkle effects, and also anti-cancer, because who wants to get skin cancers, especially on their face? So But so you have that kind of option. You can put it on your neck, you can put it on your arms, you can put it on your legs, you can put it in the genitourinary area, like you could put it around the opening of the urethra, you can put it on the labia minora, so you can put it around anywhere. That really, there's like no place you can't theoretically put it, but most people put it on their legs, their arms, or their face. Now, there is one place you should not put it. Maybe it wouldn't matter, but it's just not what we tend to do, and that is directly on the skin of the breasts. Now, there's no data, okay, but it just seems like you might grow the breasts. I mean, maybe people think, now I'm going to get people thinking that's how they're going to do it instead of getting breast implants, but we don't know. There's no data, so please don't put your estrogen cream on your breast tissue because we don't want to. We just don't know, so don't experiment there, okay? So here's the thing. A lot of people think that there's something uniquely special about compounded estradiol. Well, there is, because you can concentrate it, you can put it in different ways, different places. Like I said, with concentration, you can make all kinds of different degrees of concentration. And, so it's very practical. But it's the same thing. Inside the cream is estradiol. So where does the estradiol come from that a compounding pharmacy is using? Well, it comes from a factory. It doesn't come from the estrogen plant in the backyard. The compounding pharmacists are wonderful, but they're not creating the estradiol. They buy it in a bulk form, and then they mix it with the cream. Or whatever they're doing, they're mixing it, but they're not creating the hormone. They're creating the delivery system by mixing it with whatever the delivery cream is. Now, some people actually use oils or gels, so there's different things. I tend to use creams, but there are other products like gels or oils that compounding pharmacists can mix the estradiol into. So you have a highly unique and variable group of options when you have a compounding pharmacy that gets involved. But just know that the estradiol is still estradiol. Now, some people love it because, the compounding pharmacy doesn't have to put in some of the chemicals that might be necessary in some of the other commercial products. Now, the amounts are small, but I get it. Like people look at it and say, I don't want anything that has this type of preservative, or it could be different. So, and if you find that you want to have a compounding pharmacy product, you must know, and we'll talk about this another time too, what the quality of your compounding pharmacy is. You want really highly qualified pharmacists using the best products in the best really clean environments where they're doing the mixing. You want precision. You want real high quality. And that's why compounded products gets a bad name, because it's said, they're not as quality controlled. But that's not true. There are many really high-end compounding pharmacies where they hold to the highest of standards in terms of testing, the product quality, and so on. So I trust myself to an excellent compounding pharmacy. There are many, but you really want to know where your doctor, if you're not the doctor and you are the patient, you want to know what is the quality of the compounding pharmacy that you're referring me to. Or if you make the choice yourself, check them out, okay? Find out the credentials, if they have a really good clean room where they're doing the mixing and how they do testing and so on, because it matters. So those are really the most popular topicals. Now, there are other products that are used a lot, and I talk against them, like pellets. Oh my goodness, pellets are so popular, and they really bug me because they're the most non-physiological. Now, what do I mean by that? Well, I always say I'm a simple thinker. Now, when we are giving hormones to menopausal women or supplemental for perimenopausal, what is natural about that? Nothing. Nature planned us to have menopause so that we don't have fertility. Because remember, if we're fertile and we're like in our late 40s, 50s, and older, and we are easily able to conceive, we will die, okay? We would die in pregnancy, the baby would die, nobody would make it. So we have to end fertility at a certain age. We have to have declining fertility so we don't die from being pregnant. And we are supposed to be alive long enough to raise the kids too. So the problem is that our hormones are completely interconnected with our fertility. And so we lose these vital life hormones. And I don't want to lose them, and neither do you, and you shouldn't put up with it, even though it's natural. Natural doesn't mean it's beneficial. Like tornadoes are natural, but they're not beneficial to your house, okay? And, we won't even get into more natural disasters because I live in California. So here's the thing. We're trying to uncouple fertility from the hormones that are intricately involved in fertility. So if I'm going to do that, I want to do it in a way that is compatible with what nature gave us. I'm not going to create a whole new paradigm for how hormones should exist in the female body. I think nature did it best. I always say the biggest failed experiment of thinking we're smarter than nature is ultra-processed food. No, food is supposed to spoil, so you get it and you eat it, or you throw it away if it's bad, and then you get new food. You don't think food can be put in a time capsule and you eat it in 100 years, okay? That is a failed experiment. And putting our hormones in a pellet, I think, is a failed experiment. But a lot of people don't realize that now because it's not compatible with what hormones would be like in a healthy reproductive, say, woman who's 25. It's not even close. When they put in a pellet, the level of estradiol, and we won't get into testosterone now, but the level of estradiol is always really, really high. I never see anyone ordering levels like for weeks after they put them in because they get really, really crazy high levels, not compatible with physiological levels. And then eventually, of course, it goes down, and then maybe it's a good level, but it doesn't stay there because it's always going down, and then it's too low. So it's either too high, maybe it's okay, and then it's too low, and then you put another one in. So boop, nope, that doesn't work for me. And another time we're going to talk about having more of a rhythm to the hormones. Not today, but you certainly can't have a monthly rhythm ever when you're using pellets because it doesn't work that way. So I am not interested in pellets. Now, what about shots? You almost never hear anyone having shots. They also are not compatible with physiologic levels. You're going to get too high, and then it will ultimately be too low. And they really hurt, by the way. You would want one and not two. You would say, I'm one and done. I'm not having another one of these shots because it's estrogen in oil base. It really hurts as a shot. So nobody wants an estrogen shot. Please don't even think about it. That's why you don't hear about it, because it's not good. So get your estradiol through your skin. There's no right or wrong, and by the way, there are no comparative studies saying, well, which is best? There is no study saying which is best. What's best is what works best for you, what's compatible with what you like, and the levels that you achieve. Now, I wanted to talk more about levels, but sorry, it ran too late. So we're going to talk about levels and maybe rhythms at the same time coming up down the road. We're going to talk about that. But now I want you to take away, you want to get your estradiol through your skin, called Transdermal. You can use patches, gels, or the compounded cream, or you can use the ring, which, you have to go get your pharmacy to order it and see if they can. They're all good. Using them, you can achieve optimal levels, but you might, because they were formulated when estrogen levels were felt to be best is less, okay? Low is where you want to go. So you may have to be a little bit improvisational with your physician and use more than one, or use just a little different variety, like 1.5, or use 2 different packs of gel and so on. And some people even use 2 different types, like they'll use one small amount of gel and then one patch. So there's nothing wrong in that. And you can, of course, be very creative with your compounded estradiol, but make sure your levels are monitored. We'll talk more about that. So avoid pellets. Don't do it. Avoid pills. Oh, I almost forgot. I was going to tell you why you don't want pills additionally. The pills turn into estrone. Estrone is predominantly alpha agonist. It activates the alpha receptor, which is the dominant one in the arteries, and helps to create nitric oxide, which is a really good, important antioxidant gas, which also acts as a signaling agent, kind of like a hormone. So the bottom line is that there is good from having estrone. Remember, when you take a pill, it gets converted predominantly to estrone. So I didn't say estrone was evil. No, it's good. It's just, it's not balanced. Where's the rest of the receptor agonist part? No, you only have predominantly alpha. But it turned out there were some studies that said it did better than the transdermal for healthy arteries. They're not looking at, so the alpha is a dominant in the bone and in the arteries and also in the hypothalamus. And there's some alpha in a lot of other things, on a lot of immune cells and so on. So we want alpha. We love alpha, but we love beta, and we love the G protein coupled receptor agonist part of the estrogen too. So we want the balanced effect. The reason that the oral estrogen did better than the transdermal is because the transdermal dose was ridiculously low. Remember, dose matters. So if you compare one thing that's at a higher dose to something else that's at a ridiculously low dose, then the low dose one, no matter how good it could be at a higher dose, isn't going to do much. Okay? I hope that clarifies it a little. Please don't use oral estrogen. Increases your risk of blood clotting, and it is just not the best choice. So more on dosing and other things to come. Hormones are a critically important subject. I'm so glad that you're interested in learning about it.